Hi everyone. So I decided to do my presentation on the medication Lisdexamfetamine. So before we get into that, I just wanted to go over an overall simplified general treatment of ADHD. So ADHD is a attention deficit hyperactivity disorder, and non-pharmacological treatment usually is cognitive behavioral therapy, also known as CBT, and then pharmacological treatment is stimulants, which is the first choice. Then there's also atypical antidepressants like bupropion, and then non-stimulants like atomoxetine. But the preferred treatment is a combination of CBT and a prescribed medication. So what exactly is lisdexamfetamine? So the class is a stimulant. It is a dopamine and norepinephrine reuptake inhibitor and releaser. And it is prescribed for the treatment of attention deficit hyperactivity disorder, which has FDA approval for that, as well as FDA approval for the treatment of binge eating disorder. But it can also be used to treat treatment-resistant depression and narcolepsy. So what is the mechanism of action for this medication? So this drug technically does not become active until it's absorbed by the intestines and then converted to L-lysine, and then its active ingredient dextroamphetamine. So once that happens, it then increases dopamine and norepinephrine by blocking the reuptake and aiding in the release. So, the increase of norepinephrine and dopamine, specifically in the dorsolateral prefrontal cortex regions of the brain, helps improve concentration, wakefulness, attention, and executive dysfunction. The increase of norepinephrine and dopamine in the medial prefrontal cortex hypothalamus, however, helps improve other symptoms like sleepiness, fatigue, depression, and appetite regulation. And then the increase of specifically dopamine in the basal ganglia helps improve hyperactivity. So, what are some side effects of this medication? So, some notable side effects include things like insomnia, anorexia, headache, nausea, nervousness, dry mouth, dizziness, constipation, weight loss, sexual dysfunction in long-term use of this med, irritability, tremor, and it can exacerbate tics. And then some severe side effects include palpitations, seizures, tachycardia, psychotic episodes, hypertension, mania, hypomania, suicidal ideation, and then sudden cardiac death. So how do we dose this medication? So the initial dose for ADHD in the treatment of adults is going to be 30 milligrams per day taken in the AM. Help combat some of the insomnia symptoms as well as help them throughout their day. But it also can be increased by 10 to 20 milligrams each week. The max dose is 70 milligrams a day, and the goal range is between 30 to 70 milligrams a day. Dose effectiveness is going to be determined by the reduction of ADHD symptoms like motor hyperactivity and attentiveness and or impulsiveness. So where the patient falls for their dose between that 30 and 70 is going to depend on the therapeutic effect of the medication. So benefits of identifying ADHD and providing treatment. I found that treatment has been shown to decrease all-cause mortality for those diagnosed with ADHD, which I thought was pretty interesting. And then when researching some of the societal benefits of ADHD treatment, I found that it can help improve work performances of individuals with ADHD, as well as improving their daily functioning. And then lastly, I found that it actually lowers the risk of motor vehicle collisions for those with ADHD, which I thought was interesting. So those are some of the societal benefits of ADHD treatment. These are my references. Thank you guys for listening to my presentation, and I hope you have a great night.